The Delta variant has now been detected in 100 countries and is becoming the dominant strain in regions around the world, including parts of Europe and the United States. And as variants spread, US-based drug company Pfizer is seeing waning immunity from its COVID-19 vaccine. It says it's going to publish some data soon on a potential third booster shot and submit it to American, European and other regulators. It says it will submit for emergency authorization use here in the United States in August, although the FDA and the Center for Disease Control says Americans don't need booster shots just yet. Well, Africa, with low vaccination rates, is seen as something of an open wound for this new Delta variant to fester and to spread. The WHO's regional director for Africa warns the third wave is gaining speed across the continent and the worst is yet to come. 16 countries there are seeing a resurgence in infections, and the more contagious Delta variant has so far been detected in 10 African countries. One of the hardest hit, South Africa. It accounts for 53% of the region's infections, according to the WHO. The third wave is crippling the country's healthcare system, worsened by the Delta variant and, of course, low vaccination rates. Our correspondent David McKenzie is in Johannesburg with some exclusive reporting for us today. And David, certainly this has been the worst week in Africa, across the continent, since the pandemic began. But where you are in South Africa, we're obviously hearing reports, and I'm sure you're seeing it, of people waiting some 9 hours for hospital treatment.
Well, that's right. And much of this is hidden. The government and others haven't really shown, they might have said, but they haven't shown how bad it is in hospitals here. And you're right. This is the epicenter of the crisis, or at least the emerging crisis here on the African continent of COVID-19. More than 40% surge in infections just over the last week. It's the worst week of this pandemic so many months in, and largely because of the emergence of Delta, that dangerous variant, and a lack of vaccines. Here in Johannesburg, they just announced that the city's mayor died from COVID complications. Everybody knows someone who's sick. Many people know people who have died. And we show you just what it's like to fight this breaking point.
They hoped it would be better. Hoped that COVID-19 had done its worst. But 16 months in, and Mohammed Patel and his paramedic team are in a new, more dangerous fight.
What has the Delta variant done to COVID-19 here?
It has caused a whole lot of chaos. There's a whole lot of patients that are suffering. The oxygen levels are dropping drastically daily.
South African scientists tracking Delta saw it dominate new infections in just weeks. Patel takes us into a home south of the city.
Hello, good morning.
Where Delta is tearing through families, ripping through the country's largely unvaccinated population. Less than 1% of South Africans have been fully vaccinated. The 67-year-old patient has critically low oxygen levels.
We're going to get you through, okay? There's patients that are suffering at home because they aren't able to get hospital beds. There is no spaces in hospital, there's no ventilators available, it's completely a chaos.
The third wave has really been far more devastating, far more overwhelming.
For months now, CNN has requested access to hospitals, but we were denied. So the true impact of this brutal Delta wave has been largely hidden from view. But CNN obtained this disturbing video from the emergency room at a Johannesburg hospital.
Patients are waiting, they're on stretchers, they're in cubicles, doctors are overwhelmed, nurses are overwhelmed.
Not enough beds. And what does that result in these waiting areas of the hospital?
It's chaos.
The senior doctor wanted to speak out, reveal what they call war zone-like conditions. We agreed to hide their identity because they were afraid of reprisals from the government. In recent days, they said, the bodies couldn't be wrapped fast enough to make space for the sick.
There are patients who are dying while they are waiting to be seen, while they are waiting to go to the ward, because the resources are just being overwhelmed by the onslaught of patients.
But how does that make you feel?
The sense of helplessness, but then also almost a blunting, a desensitization that we're doing everything we can, but it's still not enough.
Patel's team is often diverted from hospitals with critically ill patients. They search for hours to find a bed. So a charity called Gift of the Givers constructed this 20-bed field clinic staffed with volunteer doctors and nurses in less than 5 days. Every single bed could give a sick patient a chance.
Well, Lynda, doctors did say that sometimes patients arrive too sick to be helped even when there is space in the hospitals. We put the questions of the question of the conditions at hospitals here in the city and in the province to the Department of Health. They responded by sending us presentations showing that they'd increased the levels of beds. Now, the only real thing that can help, people say, is vaccinations and also masking and social distancing, all the things we've been talking about for many months. We're at a vaccination site today in Johannesburg. There is some light potentially at the end of the tunnel. This vaccination campaign by the government, which started slow, has certainly picked up in recent days, and they are increasing the bracket of people from over 35s who can get those vaccines starting next week. Lynda?
Yeah, let's hope they can really ramp that up now. Good to get perspective from you there in South Africa. David McKenzie, thanks so much.